Welcome to this spoken tutorial on breast conditions in lactating mothers. In this tutorial, we will learn about breast engorgement and mastitis. Let us begin with breast engorgement. Engorgement occurs most commonly between 3 to 5 days after delivery. It occurs in both breasts simultaneously. Mothers should not confuse breast engorgement with breast fullness. Thus, now we will discuss the difference between breast engorgement and full breasts. In engorgement, breasts become firm, swollen, and painfully full of milk. It gives shiny appearance and shows dilated veins on the surface. Mother may suffer from fever that lasts for more than 24 hours and latching becomes hard for the baby. Whereas full breasts are normal, full breasts appear big but they do not give shiny appearance. Full breasts are not painful and fever is absent during breast fullness. Now, let's discuss the causes of breast engorgement in lactating mothers. Breast engorgement can occur in the following conditions. If mother has not fed the baby soon after delivery, mother is not feeding the baby frequently, baby has poorly latched on mother's breast during breastfeeding, and mother has stopped breastfeeding suddenly. Now, let's discuss how engorgement can be treated. First, ask the mother to wash her hands with the clean water. Then, bring the baby closer to the mother so she can see, smell, and touch the baby. If baby is too fuzzy, mother can smell the baby's towel. After that, mother should drink a glass of water. Then, keep wet warm cloth on the breast for 5 to 10 minutes, or mother can also take a warm shower. It will help the breast milk to come out. After that, health workers should tell the mother to relax, as excess of stress will affect the letdown reflex and milk will not come out. Now, either health worker or any family member should massage on the mother's neck and upper back. It will help the breast milk to come out. Since nerve supply towards upper back and breast is same. Then mother should start gently massaging her breast in circular motion. Massaging will make her relax and will improve the letdown reflex. All these things will help in releasing of oxytocin. It is known as oxytocin reflex or letdown reflex. Oxytocin is a hormone which helps the breast milk to come out. Then, mother should manually express some amount of milk to soften the areola. It will help the baby to latch on the breast correctly. During expressing the breast milk, mother should apply pressure around the areola. After expressing, mother should guide the areola in the baby's mouth, as it would be difficult for a baby to self-attach. Try to breastfeed on both sides. Between the feeds, mother should keep wet cold cloth on breasts for 5 to 10 minutes, or mother can keep cold cabbage leaves on breasts. She can store this cabbage leaves either in refrigerator or in earthen pot. It helps in reducing the tenderness and edema in the breast. Then, mother should breastfeed frequently. Now, let's learn how can we prevent breast engorgement. First, try to understand the hunger signals of a baby such as squirming, increasing rooting reflex. In rooting reflex, baby turns her head towards anything which touches her cheek or mouth. Sucking on fingers. In late stage, the baby starts crying. Breastfeed the baby whenever she shows early hunger signals and not wait for the baby to cry. Make sure that the baby is latched on properly and feeding well. Remember, empty one breast completely before you switch to the other side. Next, let's learn another breast condition called mastitis. It is a condition where part of a breast becomes red, swollen and hard. Mother feels severe pain, fever and ill. Many mothers go through mastitis in first 6 weeks, but it can occur at any time during lactation. It is sometimes confused with breast engorgement. However, engorgement affects whole breast and often both breasts, whereas mastitis affects part of the breast and usually only one breast. Mastitis may develop in an engorged breast or follow condition of blocked ducts. Now, we will discuss how blocked ducts develops into mastitis if untreated. Blocked duct is a condition where milk is not removed from the part of a breast. Usually, this duct is the part of breast blocked by thickened milk. It leads to lump formation. This lump is tender and often present with redness of the skin over the lump. Blocked duct and breast engorgement causes milk stasis. When milk stays in part of a breast in blocked ducts and breast engorgement, it is called stasis. If this stasis is not removed, it could lead to inflammation of breast tissue. It is called non-infective mastitis. Whereas sometimes breast becomes infected with the bacteria and this is called infective mastitis. In following conditions, bacteria will easily enter through fissure. If fissure is present on the breast, mastitis remains untreated and delayed treatment. Note that breast abscess is a progression of untreated mastitis. Now, let's discuss the causes of mastitis. The first and foremost cause of mastitis is infrequent feedings. If lactating mother is a working woman, then frequent breastfeeding becomes challenging. Other reason for infrequent feedings could be illness in mother or a baby. Second is nipple feeding. In nipple feeding, baby will not empty the breast completely. Third is oversupply of milk. Fourth is rapid weaning, where baby eat other foods apart from breast milk. Fifth is tight clothes. If mother uses tight clothes, especially in night if mother wears a tight bra, it brings pressure on the breast and can block the milk ducts. Sixth is maternal stress. If mother is going through any stressful conditions, it will affect the letdown reflex. Seventh is nipple fissure. It provides a way for bacteria to enter the breast tissue and may lead to mastitis. Let's look at the treatment for mastitis. First, try to identify the cause and then start the treatment. Mother should use warm compresses before breastfeeding or should take a warm shower. She should start breastfeeding from affected breast first. If it is increasing the pain or affecting the letdown reflex, then start with the unaffected breast. Remember, frequent breastfeeding is necessary. If the open wound is not on the nipple or on the areola, then mother can breastfeed on the affected side. Remember, whenever a mother is feeding to a baby from mastitis breast, she should monitor the baby for signs of infection as there will be a risk of infection to a baby. Since breast milk from affected side will have many harmful bacteria. Massaging the breast may improve the milk supply. It should be a gentle massaging from affected area towards the nipple. And mother should take enough rest. If symptoms are severe, then she should refer to the doctor. Breast abscess will require surgical drainage of abscess and antibiotics. Apart from these, mother should make a special effort to relax her body and breathe deeply and evenly. Listen to the soothing music and think about your baby to help in starting the letdown reflex. Remember, for preventing mastitis, correct latching is necessary. It will avoid blocked duct and baby will get enough milk. Keys to prevent all these breast conditions are proper attachment and positioning of a baby and frequent breastfeeding. This brings us to the end of this tutorial. Thanks for joining.